This is the Justicefighter podcast. Justicefighter podcast. With attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justicefighter podcast, y'all.
This is not a test. This is a real life or death state of emergency. I'm calling out to the African American community to give you some facts. We are in a life or death state of emergency. 1 out of 10 Americans are black. 1 out of 2 of the corona fatalities are black. We are in trouble, my people. We have to come together. We have to communicate. They're not going to give us any time on the news. They're not going to come up with the solutions for us. We have to come up with our own solutions. Check this out, okay? In Illinois, out of 15%, 42% is African American. In Louisiana, African American. In Michigan, 41% African American. Out of 16,000 deaths, 8,000 of them are African American.
So we're here on the Justicefighter podcast. This is Attorney Gerald Griggs, and we're going to continue to cover the coronavirus epidemic. But as you have heard from Puff Daddy, and you will hear from Van Jones in a few minutes and others, this is a systemic issue that's hitting the African-American community at a disproportionate rate. We've been reporting on this for a while, and I'm glad that others are joining the conversation. But this is an article I wanted to read to you from the Washington Post. This was from, it was April the 10th, 3:10 p.m. from Eugene Scott. And he says, a Washington Post analysis of early data from jurisdictions across the country found the novel coronavirus appears to be affecting and killing black Americans at a disproportionately high rate compared to white Americans. Majority of the black communities have 3 times the rate of infections and nearly 6 times the rate of deaths as a majority of white communities, according to the analysis. Why is it 3 or 4 times more so for the black community as opposed to other people? President Trump asked at Tuesday's White House task force briefing. It doesn't make sense. I don't like it. And we're going to have statistics over the next probably 2 or 3 days. But on what we know with the inequities in many black communities, it does make sense. The fit dug into better understanding why the coronavirus is apparently killing African Americans at a faster rate than any other groups. Here are some of the causes and reasons. A higher rate of underlying health conditions and a less access to care. Data has shown that black Americans have a higher rate of hypertension, heart disease, diabetes, lung disease. Medical professionals have said the coronavirus exacerbates the challenges that come with illnesses. That's why the Trump administration officials cited first when they were talking about disparities in Tuesday's briefing. Health disparities have always existed in the African American community, but here again, with the crisis now, it's shining a bright light on how it's unacceptable that this is. Dr. Fauci, director of the National Institute of Allergies and Infectious Diseases, said Wednesday. The second reason for this disparity, black Americans have a lot of the essential jobs. Black people are more likely to work in jobs that put workers in close contact with others who might be in poor health, that maybe engaging in social distancing make more difficult. The third reason, insufficient information. Kanisha Grant, a political science professor at Howard University, focuses on black voters' relationship with state and local governments. She says poor information from the government leaders has helped shape black people's experience with the coronavirus. In short, I think the problem is that black people don't get enough information from their governments. The problem is we have got bad and inconsistent information from our governments, and we also got information that didn't seem to represent the people who look like us, she said. And the fourth reason, housing disparities. A 2017 Princeton study found that black children are more likely to suffer from asthma because they live in older buildings that harbor fecal material, rodent infestations, and which are in segregated neighborhoods that are near busy highways that put harmful matter into the air. The Center for Disease Control and Prevention released information stating that black people with asthma may be at greater risk of dying from the coronavirus. People of color are more likely to live in densely populated areas in multi-generational housing situations, which create a higher risk for the spread of the highly contagious COVID-19, the Surgeon General, Mr. Adams, said on Friday. And these are just some of the underlying reasons. But I want to take you to the conversation that was being had on CNN that also has some of the sound from the press conference with the White House that was held on Friday.
When you look at being black in America, number one, people unfortunately are more likely to be of low socioeconomic status. which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease, and I and many black Americans are at higher risk for COVID. It's why we need everyone to do their part to slow the spread.
Right now, slightly more than 70% of all of our deaths are among African Americans, who make up about 32% or so of the overall population of our state. So obviously this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible.
So, first of all, we have to be clear that in December 2019, none of us was immune, right? So all of us should have an equal opportunity of being infected. But what this virus has done is taken away the mask, the veneer, pull the sheets off of this myth of equal opportunity in this society. So what is happening is that black folks are getting infected more because they're exposed more. And once infected, they're dying more because their bodies, our bodies, have borne the burden of chronic disinvestment, active neglect in our communities. So when I look at it, it is because of structural racism, which puts us in the more forward-facing jobs so that we're more exposed and less valued, don't even have the protection that we need. And this chronic, the residential segregation that turns into employment segregation, educational segregation, environmental hazard segregation, all of those insults on our bodies have given us more of these so-called pre-existing conditions. So once we're infected, we have more severe outcomes from the disease.
We got off on the wrong foot here from a media point of view and from a community point of view. Everybody started saying in the black community, this is a white folks thing. You're hearing about white folks in nursing homes. You're hearing about white folks who went to China. And in fact, a rumor got started that black people were literally immune to this disease. That was all over the internet. Started off as a joke. People took it seriously. And in fact, you've seen this before with HIV. Oh, HIV, that's just for gay people. I don't have to worry about it. And then it spread everywhere. This is a disease. The numbers for the black community are going to be completely different than the numbers coming out of China or Italy, because it's an epidemic jumping on top of a bunch of other epidemics already in the black community. We already have an epidemic of high blood pressure, which is lethal if you get this disease. Nobody's saying that. We already have an epidemic of asthma, obesity, etc. In other words, you got to start saying to your black relatives, your black friends, do you take pills every day? If you take pills every day, are you supposed to? Get your butt in the house and don't come out, because you are going to die. Well, I'm not 80 years old. No, it's not just age. In our community, it's going to be, are you sick? And black people are underinsured, underemployed, and barely healthy on a good day because of things that were just mentioned. We have to change the discussion. We can't say comorbidities. That doesn't mean anything to the people who are in harm's way. The people who are in harm's way, do you take pills every day? Do you got sugar, diabetes? Do you got pressure, high blood pressure, hypertension? You could die in a week. You could not be here. You've got to start screaming this to the black community, or you're going to have a catastrophe on your hands here.
And so that was Van Jones and CNN reports. And we do have to really have this conversation in the African American community, because there is an epidemic of coronavirus infections, not only in New York, not only in Chicago, not only in Milwaukee, not only in Louisiana, not only in Dallas, Texas, but in Georgia. And so if you look at the numbers in Georgia, and they released the numbers this morning for Saturday, and there are 12,159 cases of coronavirus in the state of Georgia. And we have 2,479 individuals that are hospitalized, and 428 citizens have passed away. But if you look at the top counties that are infected, you have Fulton County, you have Dougherty County, you have Cobb County, you have DeKalb County, you have Gwinnett County, you have Clayton County, you have Hall County. You have counties with large African American populations, and we still aren't really teasing out the racial breakdown by county of the number of infected. We just finally got the information from the Department of Health as to the racial breakdown. And currently in the state of Georgia, there are almost 3,000 individuals that are infected with the coronavirus, and that by far and away leads any racial group in the number of infections, and we don't have it broken down by deaths. But you can see the disparities being spoken to in real time by the statistics. And I agree with my brother Van Jones that we have to speak in language that folks understand, not in colloquialisms that the Surgeon General tried to give, but in real concrete terms. If you have a health condition that suppresses your immune system, if you have a chronic disease like hypertension, or you have obesity, or you have asthma, or you have any breathing difficulties, this virus can be deadly. We have to dispel the foolishness that's happening on social media and around the internet talking about 5G. 5G has nothing to do with this, and the World Health Organization released a statement on that. And we have to speak to our conspiracy theory brothers and sisters who want to blame this on everything but the person in the mirror. We have to take our most precious gift that we have, and that's our health, more serious. We have to, in this moment, speak truth to our loved ones, and that this virus is killing African Americans. We have to take a moment and really, really speak to that. We are now hearing from our celebrities, we're hearing from the experts, but we have to hear from one another. And that's to be real. And that's to be loving and concerned that this virus is killing us. And we have to use our platforms to inform people of reality. And so that's why I want to bring this to you on Justicefighter podcast on the Justice Media Network, so you can hear the numbers and you can hear from our community directly. You can see what's happening in Louisiana. You can hear from the governor of Louisiana speaking directly to this. You can hear from the mayor of Chicago, Lori Lightfoot, who was appalled when she saw the numbers in Chicago, and there's an epidemic in the Cook County Jail right now. You can see the issues that are happening in our prison system with our brothers and sisters that are behind bars, and we all know there's a disproportionate amount of African Americans behind bars. But we are seeing in real time what this disease is doing to our community. And so we are at our Pearl Harbor moment. We are at our Civil War moment. We're at our civil rights movement moment, where we're going to have to decide for our community, what are we going to do about this? Are we going to hold our elected officials accountable? Are we going to hold President Trump accountable when he goes to the podium and when asked about the disproportionate amounts of coronavirus infections in the African American community, starts talking about job numbers? We're not talking about job numbers. We're talking about public health. When the Surgeon General of the United States of America uses colloquialisms, we don't need colloquialisms. We need the hard numbers, and we need to know the numbers of tests that you are getting into the African American community. And we need to speak to this. We need to ask the governor of this state, Georgia, why did it take numerous news articles for you to release the statistical data? Why do you still have a law that prevents people from wearing masks when the CDC says masks are advisable to protect them from the virus and them from each other? These are serious questions that we have to ask, and we have to stop having these ridiculous debates on social media about cell phones. Because I'm gonna let you in a little secret. 5G releases the same amount of radiation as your microwave. So if we really are concerned about radiation poisoning, are we going to take our microwaves out of our houses? No. So let's focus on what the real issue is. When the World Health Organization, the preeminent doctors in the world, tell you this has nothing to do with radiation, stop spreading it and start spreading this. Spread the fact that 3 to 4 times more likely to get infected, 3 to 4 times more likely to die. We're seeing young black people die. We're seeing old black people die. There was a couple that died right off of Cascade Road within hours of each other. For people to be spreading this information and not being considerate of others who are in pain of losing loved ones, that's inconsiderate. It's time for us to pull together. And in the words of Puff Daddy, this is an emergency. So my hat's off to the celebrities that are speaking truth to this. And I would ask the ones that are using their platforms to spew more conspiracy theories to stop in this moment, because you History will not remember you well for the theories that you were spewing in the middle of a pandemic where your people were dying. This is not the time to be quoting spiritual leaders who have not held individuals who are dying or who are in the throes of this. We need to lift up our healthcare professionals who are on the front lines. We need to lift up our essential workers who are on the front lines. We need to pass out love in our community like we always do. And we need to get to the end of this. So I'm going to continue to bring you the important information on this public health emergency. And I'm going to continue to bring it to you on the Justicefighter podcast on the Justice Media Network. So I'm just asking you, as humbly as I know how, please stop sharing the foolishness and let's focus on the real problem. The problem is the disease. The problem was the lack of concern for the community by a certain administration from November to now. And the concern is that if the government opens back up on May the 1st, you know which community is going to get hit the hardest. We're already getting hit. So we need to focus on a concerted effort as a community to address this. We need the experts to come to the front of the line, and we need to elevate their voices so they can speak truth to power. They can speak wisdom to the unwise, and that they can deal with this pandemic so we can get back to the business of loving one another. I know it's the Easter season, and a lot of people are going to be celebrating the risen Christ tomorrow. Well, let's celebrate the risen Christ today by loving our brother as ourselves, by doing the work of healing the sick and casting out the demons. And let's focus on the real problem. And let's be what we are, what we say we are. Let's be our brother's keeper. So this is Attorney Gerald Griggs, the Justice Fighter. I'm going to continue to bring you this information on this platform. Please share it. Please like. Please subscribe to the podcast, and I'll see you at the next pod.
This is the Justicefighter podcast. Justicefighter podcast. With Attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justicefighter podcast, y'all.
Hey guys, this is Attorney Gerald Griggs, the Justicefighter, here on the Justice Media Network. And I appreciate you guys listening to the Justicefighter podcast. I appreciate you subscribing on all streaming platforms. I appreciate you sharing this with your friends and your family, because it's the only way we're going to get the information out in this digital age. So please like, subscribe, share. Please comment. Let me know your thoughts, what you want to hear on the Justicefighter podcast, who you want to come on. And most importantly, be good to one another. Fight for justice. Fight for your brother. And elevate yourself. I love you guys. I'm the Attorney Gerald Griggs, the Justicefighter, and I will see you at the next pod.
This is the Justicefighter podcast. Justicefighter podcast. With Attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justicefighter podcast, y'all.